Good morning, everyone, and welcome to the second talk of this series in the course of epidemiology. And we know that today we have Dr. Doke with us for his second session of the course, and we will soon start with his session. Over to you, sir. Just one instruction was there for participants that we are monitoring your attendance. We will be sending a Google form at the end of when the question answer session starts. So kindly fill up that form because we will be monitoring that for certificate and all like all sessions you should attend for for getting a certificate. So we request you all to kindly fill up the attendance form.
Is the screen visible?
Yes, sir. We can see the screen now. You can just go to full screen mode.
Yeah.
Yes.
Good morning, dear friends. I hope that last time we have discussion and you remember it. Today we'll be going one step ahead. As we discuss this whole epidemiological exercises and knowledge is essential from the point of view of application. And another important area for application, particularly in the respect of control of health related problems, is to know some more details about disease. So today we'll be discussing salient features of disease. Most of these epidemiological principles, they emerge from infectious diseases. The reason is obvious. The highest burden of diseases till before a decade or so was due to communicable diseases, infectious diseases. Therefore, all this knowledge is basically focused on infectious diseases. But then the principles are so beautiful, they can be easily applied to non-communicable diseases also. So what we discussed today is majoritarily focusing on the infectious diseases, but it can be made applicable to non-communicable diseases also. We'll be discussing, having brief information about natural history of disease and levels of prevention. In this 45 to 50 minutes of discussion, we'll be touching briefly what is the concept of disease, theory of disease causation, natural history of disease, risk factors and risk approach, and one very peculiar phenomena, what is called as iceberg phenomena, levels of prevention and levels of intervention. So what is a disease? World Health Organization has defined health very beautifully. But about disease, there is some silence. In short, we say that disease is a physiological or psychological dysfunction, whereas illness is a subjective state of the person who feels aware of not being well. And the third concept is sickness. Sickness is basically a state of social dysfunction. That is the role of that the individual assumes when he or she is sick, sickness role. And we expect that we people offer us bouquet, they say us get well soon. You must be remembering the pictures, get well soon, get well soon. So basically the person takes the role of a sick person. So these are three different distinctions between disease is medical or biological sciences, illness is subjective, psychological, and sickness is a social role. Before learning anything about disease, we must know how the disease is caused. And Disease slowly progress from initial concept to lastly multifactorial concept. What was the initial concept? What we call as supernatural theory. Mankind was believing that diseases are caused by curse, diseases are caused by sins of past life, and something like that, or black magic, or bad eye. These were thought to be the causes of disease. Then came the era of germ theory, and this is very dominant area in the history of medicine and diseases. And particularly stalwarts like Louis Pasteur, Henry Cox, they propagated theory. At that time, as I said, most of the diseases were infectious diseases, plague, cholera, typhoid, all these diseases. And at the root cause of all these diseases was some bacteria. Therefore, it is called as germ theory. Similarly, in Ayurveda, there is another theory. Ayurveda says that in the body there are three types of dosh: vata, pitta, and kapha. And the imbalance between the three doshas results into a disease. Then another and most important trial is epidemiological trial. In last lecture, we have seen that a disease cannot be caused by a single cause. For student, we always ask, what is the cause of tuberculosis? Very promptly, students say Mycobacterium tuberculosis. Yes, it is 100% true. But Mycobacterium tuberculosis doesn't cause tuberculosis into a test tube. It causes disease to human beings only. So, epidemiological triad, we'll see about this epidemiological triad later. And the last is the multifactorial causation. For every disease, there are multiple factors. The only thing is that we have to search for this multifactorial etiology. As I was saying, the germ theory of diseases is currently accepted as the most scientific theory for many diseases. It's a very dominant theory. The germ may refer not to just a bacterium, but to any type of microorganism, such as protists, viruses, or even non-living pathogens. We call as non-living pathogens like prion or viroids, etc. These are called as germ theory. These are the various types of germs. And this is the classical example, triad. Every disease, like Ayurveda, is imbalance between environment, agent, and host. Imbalance, or in better word, we can say interaction. Interaction between agent, host, and supported by environment that leads to cause of the disease. The role of environment cannot be overemphasized. It is the most fundamental one. We'll see what are the various ingredients in these three types of etiological factors. Simplest cause of disease and agent, and a substance, living or non-living, or a force that excessive presence or relative lack of which may initiate or perpetuate a disease process. Biological agents, which you have seen in germ theory, bacteria, protozoa, viruses, fungi, they are all biological agents. Nutrient agents, particularly in nutrient agents, we remember deficiencies of vitamin. Deficiency of vitamin C leads to a disease like scurvy. Physical agents, basically injuries. Chemical agents, those who are working in chemical factories, they're exposed to chemicals and they get dermatitis, or maybe chronic lung diseases due to inhalation of chemicals or something like that. And one of the greatest tragedy in the chemical agents in the mankind is the Bhopal tragedy. Inhalation of toxic gas, mechanical agents, again basically related with accident, and social agents. You can consider depression as a disease. If depression, mental depression is a disease, the commonest cause or the multiple causes related to such disease are in the social environment. And particularly, we are all aware, many of must be young students. In the months of April, May, June, July, the rate of suicides goes very high, and many of them they are students. They expect wonderful results, and when they get these results and marks, some of them they commit suicide. This is all social agents. Host again, the host theory is basically like Ayurveda. Something is wrong with your own body, and therefore the germ is causing the disease. We can give simple example of immunity. A germ may not cause disease in all persons. It causes disease only in susceptible or those who are non-immune. Therefore, role of host factor is also equally important. The host factors may be classified into many things: demographic characteristics, biological characteristics like age, sex, genetic makeup. These are biological characteristics. Social and economic characteristics. They may not be direct causes, but they are always correlated. And lifestyle characteristics. Again, young friends, here with permission of university, I will like to quote one example how the lifestyle is changing. Once I was traveling from Mumbai to Kolhapur. The train starts from Mumbai at about 9:10 p.m. and reaches Kolhapur early morning. Being a senior citizen, I was given a lower berth. And there was a young lady in the upper berth. All the night, she was talking on mobile and she didn't sleep. She didn't allow me to sleep. So this is the lifestyle we are having. And this lifestyle is leading to sequential consequences. And particularly, lifestyle characteristics are causing what we call as the degenerative or non-communicable diseases. Environment. Again, I am emphasizing here, role of environment cannot be overestimated. Even the genetic makeup is changed by environment. And this is the evolution. Because of environment, evolution is there. And because of evolution, we are getting various diseases. Physical environment, yes, humidity, temperature, etc. Biological environment, surrounding life, and psychosocial environment within ourselves. So most of these causes of diseases, when we group into three: agent causes, host causes, and environment causes. Why it is necessary to know about such a number of causes? Here probably the slide is not very clear. It only depicts how major cardiovascular diseases are produced. Lifestyle diseases. Lifestyle includes smoking, it includes addiction to drugs, it includes your nutrition, your intake, it includes lack of physical activity, it includes your posture, sitting, and any exposure to various types of rays. And nowadays we are getting a syndrome, carpal tunnel syndrome among software engineers. all the time they are using computer at PC and they are getting problems of fingers. So this you have to learn. This is a basically multifactorial etiology. This is very beautiful slide. I have taken it from World Health Organization, one of the document, and I'm showing this to all young students because today across the world and in India, number one cause of death is ischemic heart disease or what we call as coronary heart disease. I'm sure everybody is aware that this is the commonest cause of death on the globe. So let us see how this multifactorial etiology is important in the commonest cause of death. On the right, there are given three important host-related factors: age, education, and income. They are primarily related to host. Then the second one, the second row is also related to host, but this is secondary. The first one was primary, this is secondary. And what is that? I was explaining to you: physical inactivity, fat intake. Again, you will not believe. We advise what is called a square meal, meaning eating vegetables, food grains, dairy products, meat products, green leaf vegetables, and fruits. This or combination of all these in each meal is called a square meal. We carried a small experiment in our medical college. When the student is having the square meal and the average was 20 days, the students take the advised square meal once in 20 days. And what is the common food? Pizza, burger, noodles, or sometimes vada pav. And fried item, French fries. That is the most popular dish. What is the fat intake? This leads to physical inactivity. Fat intake leads to overweight. And secondary factors are alcohol, smoking. And they further lead to type 2 diabetes, raised cholesterol, raised blood pressure, and ultimately ischemic heart disease. So they are all interlinked. They are shown arrows, what results to what. It will not be 100% like this, but it is the thematic representation how ischemic heart disease is produced. And therefore, I was emphasizing that for each disease, there are multiple factors. Let us take one more example. This was an accident. Again, in our concept, not a disease, but in modern concept, accident is also considered as a disease. So here it described as an accident. An accident took place in Midland City, Texas, USA on 15 November 2012. A parade of floats was en route carrying some wounded Iraq War veterans and their spouses, taking them to a banquet arranged in their honor. While crossing railroad tracks in the city, a freight train collided with the second float of the parade, killing 4 persons and injuring several others. The National Transportation Safety Board investigated the accident, and the findings illustrate multifactorial etiology of events, chain of events leading to the accidents. What happened? The air horn of the first of the two floats in the parade sounded like a train's horn. I am again reading. The air horn of the first of the two floats in the parade sounded like a train's horn. The driver of this float was honking it periodically during the parade for spectators. That confused the driver of the second float, which, while crossing the railroad tracks, was hit by the freight train speeding at 65 miles an hour. Actually, the driver of the engine was sounding its horn when it was approaching the crossing, but the driver of the float thought that it is the horn of the first float. It so happened that the driver of the first float had honked just 2 seconds before the oncoming train blasted its horn. The driver of the second float had seen the train at a distance as his float was approaching the railroad tracks, but believed it would stop. Believed that the train had stopped. He was being escorted through the city streets of police, who had directed him through the red traffic near the crossing. Therefore, the driver assumed that the police were there to keep the path clear of cross traffic. The Union Pacific Railroad Company was never informed that a city parade was going to cross the tracks. In previous years, a city policeman had given notice to the railroad, but he had retired before this parade. The railroad board had designed the railroad's crossing to give 25 seconds of advance warning. But at that time, the warning lights and the bells went off, and the arms of the gate descended to block traffic only 12 seconds before the train arrived, as against a minimum of 20 seconds required under the federal law. See now how much complexity was there in this accident, and this was very beautifully investigated what were the flaws. So my point here to stress you that as a epidemiological student or epidemiologist, you should always search in details what is that, what was that, what it happened, why it happened. After learning that there are multiple causes of diseases, but then disease doesn't appear overnight or in next hour. It passes through various stages, and this is called as natural history of disease. The way in which disease evolves. It can be grouped into two stages of phases. Pre-pathogenesis phase, that is interaction between agent, host and environment, and pathogenesis phase, early pathogenesis, late pathogenesis and outcome. So this is again a very classical slide you will find on websites, books, etc. If you see from the top, it says that there is a phase of pre-pathogenesis and a period of pathogenesis, divided into two compartments. The disease process starts before man is involved. Agent, host, and environment. These are interaction between them. We have seen various agents, various host and environment. These bring agent and host together and produce disease provoking stimulus. And this disease provoking stimulus is executed functions in the human body. In the human body, what happens again? There are four stages. See the bottom of the first box. Early pathogenesis, discernible early lesions, advanced lesions, and convulsions or death, whatever is that, recovery or death, depending upon severity of the disease. There is interaction between host and the stimulus and the host reaction. So take an example of infectious diseases. When the infectious agent enters in the body defense mechanism starts. And then what happens? Either the infection is aborted or it becomes a mild one and then disappears, or it goes into severity. So the stimulus of agent becomes established and increases by multiplication of the organism. The tissue and physiological changes occur, and among some there is clinical horizon, means the person gets signs and symptoms, and after signs and symptoms there is pure illness or disease. The disease may lead to some disability or defect. It may be an acute stage or chronic stage, and again there may be death or a recovery and convalescent period. So this is in short the natural history of disease, and below that there are given levels of prevention. Before the agent enters, the stimuli applies to the human host, we can carry out what is known as primary prevention. In the early phase of disease, we can have secondary prevention, and in the late stage, we have tertiary prevention. Based upon the levels of prevention, there are modes of interventions. For primary prevention, what is the mode of intervention? It is health promotion and specific protection. For secondary prevention, it is early diagnosis and treatment, and tertiary prevention, it is disability limitation and rehabilitation. Let us consider them in some details. Before that, we must know there are some risk factors. Presence of risk factors make a person vulnerable, and there are some criteria of vulnerability. Usually, children, pregnant women, immunocompromised persons, they are supposed to be vulnerable. A factor, the presence of which makes the person more prone for the development of diseases. And the risk factors may be of various nature. The risk factor may be truly causative, like smoking in lung cancer, or the risk factors may be contributory only, lack of exercise for coronary heart disease, or it may be a predictive in statistical sense. There is no clear-cut biological explanation, but there are indirect relationships. Illiteracy for perinatal mortality. And the second axis of classification of these factors is called as modifiable and non-modifiable factors. What are the modifiable factors? The lifestyle changes we have seen, they are all modifiable. Whereas age, sex, genetic makeup, factors related to these aspects are considered as non-modifiable or not easily non-modifiable. I'm sorry, this is the picture taken. The clarity is not there. I will read for you. There are surely and strongly related factors. For heart disease, which are the prominent risk factors? Smoking, high blood pressure, elevated serum cholesterol, diabetes, obesity, lack of exercise, and type A personality. So as you have seen, natural history of disease. First, it is the your lifestyle changes, you are including intact. Obesity, we call this diabesity, means combination of diabetes and obesity. This diabesity along with high blood pressure is almost certain to lead to coronary heart disease. For cancer, again, smoking, alcohol, solar radiation, ionizing radiation, worksite hazards, environmental pollution, medications, infectious agents, dietary factors. In infectious agent, one thing is herpes. This is related to CA cervix. Stroke, for stroke, high blood pressure, elevated cholesterol, smoke, high blood pressure leads to severe intracranial bleeding and resilient to stroke. So there are two stripes, that is bleeding and the other is blockage of this. Both cause stroke. Motor vehicle accident, as I was telling, this is considered as a modern disease. Alcohol, non-use of seat belt, speed, automobile design, and roadway designs. These are all factors. And in India, almost most important is the alcohol, what we call as the weekend night syndrome. Diabetes, obesity and diet, cirrhosis of liver, alcohol. These are the well-known prominent risk factors for these diseases. So when you know the risk and persons having this risk, we were discussing about intervention. Here the intervention may be a specific approach, what is called as high risk approach. The first principle is something for all, but more for those who need in proportion to need. That is called as high risk approach. To give example further and again very classical. In pregnancy, we consider adverse pregnancy outcome. Adverse pregnancy outcome means there is abortion or stillbirth or low birth weight baby or premature delivery or baby with congenital anomaly. These are all called as adverse pregnancy outcomes. And we know that for this adverse pregnancy outcome, some factors are regularly related with this outcome. What are these regularly related, correlated factors? The first is multigravida, third, fourth, fifth gravida, or young priming. What is important? A lady having anemia. She, if bleeds, she bleeds to death. What else? Inter-pregnancy interval, too short and too frequent pregnancies. And a lady having hypertension or developing preeclampsia. So we know that these are the risk factors. So this high risk approach is specifically pay more attention to the women who are having these factors. I hope now you understood the high risk approach. High risk approach basically is a managerial tool. You have limited resources and you have to use these resources judiciously. In natural history of disease, we have seen that some person respond to the infection or to the disease agent in different ways. And in infectious diseases, what we see is only 10%. Those who are having symptoms are 10%. And 90% are the people who are not having symptom and who don't come to the clinical horizon. This phenomena is called as iceberg. It's a very dangerous phenomena. Although the pictures look very nice, the phenomena is very dangerous. And there are diseases. I will use particularly example of polio, hepatitis, cholera. These are the diseases where majority of the persons having disease are asymptomatic. What is its implication? See on the right side, severity. Those who respond severely, they have sign symptoms, and then what is affected is they are sick, they are ill. Subclinical, only mild or supplacement, it is so mild that the person will never approach a doctor. And when they are discernible or symptoms are severe, the person probably takes opinion of health worker. This is called a clinical picture. So it ranges from normal to severe clinical. And those who are asymptomatic or very mild, they come to the notice of medical system. But then actual loss is there. Their number is very high and they continue to spread the infection. Therefore, they are more dangerous. All infectious diseases where asymptomatic cases, mild cases are more, they are dangerous because they continue to spread. They don't come to the notice of medical system and they are super spreaders or heavy spreaders. So based upon the natural history of disease, there are levels of prevention. The first level of prevention is called as primordial prevention. This is basically used for prevention of chronic, degenerative, non-communicable diseases. Prevention of the emergence or development of risk factors in the population in which they have not yet appeared. So, can you think of any population where the diet pattern, physical inactivity, or dependence or addiction has not entered? So, in fact, this is context of addiction or smoking. Smoking is a risk factor. Don't allow people to smoke. Don't allow people to allow in the sense that encourage, motivate. I don't say that you have to file legal cases against them, but basically you have to avoid. This is called as primordial prevention. It is not directed to any disease. It is basically prevention of appearance of or acquisition of risk factors. The second level is called as primary prevention. Action is taken prior to the onset of disease. Again, sorry. Again, actions taken in primary prevention are also before the onset of the disease. But then these actions remove the possibility that a disease will occur. This intervention may be pre-pathogenesis phase, and there are two again strategies: population strategy and high risk strategy. Population strategy is that you carry out intervention to all the members of the community, and the second approach, carry out intervention for those who are having the risk factors. And the classical examples are sanitation, immunization, and infection control. To give an example, drops of polio, they prevent you from a specific disease and before the appearance of the disease. Infection control activities in a hospital or anywhere, they are not directed to X or Y disease. They are directed to almost all infectious diseases. Secondary prevention, action which halts the progress of a disease at its incipient stage and prevents complication. In the context of infectious diseases, this also stops spread of the infection to other persons. Therefore, even though the step is applied after diagnosis, it is certainly a prevention for rest of the people. Tertiary level of prevention, intervention in the late pathogenesis phase, all measures available to reduce or limit impairments and disabilities, minimize suffering, promote patients' adjustment to the irremediable conditions, this tertiary prevention. Based upon the levels of intervention, there are modes of intervention. There are 5 modes of intervention. The first is health promotion, specific protection, early diagnosis and treatment, disability limitation, and rehabilitation. What is health promotion? Basically, process of enabling people to increase over and to improve health. What is called as positive health? That is not directed against particular disease. And what are the activities undertaken under health promotion? The first and foremost important is health education. In the last interaction also, I am told for changing behavior, it is very difficult. It requires tendency on the part of those who is counsel, those persons who are counseling. Repeatedly, you have to counsel him. Health education is the same. You have to repeatedly using various media communicate to the persons uh, environmental modifications, nutritional intervention. I will give one example of each. Intervention, environmental modification, what is it? It is as simple as that. In dengue, the virus is transmitted by mosquito called Aedes aegypti. And this mosquito favors sundry articles in which rainwater is collected, like coconut shell, dustbin, or various cans, unused cans. The rainwater gets accumulated, and that is the haven for Aedes mosquito. So what is the environmental modification? Thoroughly cleaning surroundings of the home that prevents specifically all mosquito-borne diseases. Here again, what I'm saying that it is not X disease or Y disease, although primarily it is for dengue, but it will prevent many other vector-borne diseases, and not only vector-borne diseases, even food-borne diseases because of insects. So the point here is this: environmental modification leads to a variety of prevention of diseases. Nutritional interventions, what we were discussing, food intake, that is also non-specific, but it prevents many diseases. Lifestyle and behavioral changes, all these are health promotional activities. The second are specific protection. This X intervention prevents Y disease, and the best example is immunization. Polio vaccination prevents polio disease. TT vaccine prevents tetanus toxoid. So these are the specific protection. Use of specific nutrients, taking vitamin C, taking B complex, taking vitamin D. Vitamin D specifically prevents rickets. Vitamin C prevents scurvy. Protection against occupational hazards. That is against specific protection. Wearing gloves, wearing masks, wearing caps. These are the specific. And protection against accidents, as we were discussing, use of seat belts, then the road traffic signals, respect to road traffic signals. The early diagnosis and treatment, I was discussing that. You may feel that once the disease has developed, how we can say early diagnosis and prevention, mode of prevention, how it can be a mode of prevention. Yeah, in true sense, early diagnosis and treatment may not be considered as mode of prevention, but what we prevent, By early diagnosis and treatment, we prevent complications. We prevent spread to other tissues. We prevent infection spread to other persons. So if you consider all this, certainly early diagnosis and treatment is also a mode of prevention. Disability limitations. Now, the earlier was specific early diagnosis and treatment. Now here a stage has one step ahead. The patient or person is having a full-fledged disease. What we have to prevent? We have to prevent what is called as impairment, disability, and handicapness. These terms are slightly confusing. Let us say what they exactly mean. Impairment means any loss, psychological, physiological, or anatomical structure or function. It is anatomical loss or physiological loss of any organ or any function is impairment. Disability, unable to carry out certain activities. And handicap, limitation of the role in the society. I have given the role of a teacher. If I am not able to speak, this is I am not performing my role in the society. I am handicapped, right? Disability, a person who has lost his limb in accident cannot play football. So disability in activities and impairments, temporarily there is damage and for short time he or she cannot do, that is impairment. So these are the severity one by one. Again taking the same example, accident has occurred, loss of food is impairment, cannot walk is disability, and he or she is unemployed is handicappedness. So in short, the third phase is called as rehabilitation, the combined and coordinated use of medical, social, educational, vocational measures for training and retraining of the individual to the highest possible level of functional ability is the rehabilitation. And those who are suffered, they need rehabilitation thoroughly. And one of the very classical example of rehabilitation is that we change the occupation. The management give me a different function or slightly different role. The rehabilitation may be medical rehabilitation, social rehabilitation, vocational, educational, and psychological. I think this was all what I want to convey. If you have any queries, any comments, most welcome.
Okay. Thank you, sir. So while the students type their questions, sir, would you please just elaborate on where does family history or how do we classify family history as a uh, risk
Uh,
factor and how do we address this in levels of prevention?
yeah, family histories. The reason is that usually the members of the family, they take similar diet. Whatever is prepared in the food, so diet is common. Then physical environment, that is also common. Therefore, if an infectious agent enters in the family, it is very likely that the infectious agent will affect all the persons.
Okay.
That will also affect the physical things like what we call as the crowding
Okay.
and also ventilation. These are the risk factors for respiratory illnesses. So we take family history for these factors. And lastly, their genetic susceptibility.
Okay.
Because they are blood related, genetically they have a very common pool. So these are the three things: environmental, physical environment, social environment,
Hmm.
diet, this is common, and thirdly, genetic. So everybody is exposed to the similar disease or the same disease.
Hmm. Okay. So there is one more question. Uh, could you please give us example of preclinical screening? What do you mean by
Yeah.
that?
So screening is a procedure where a simple test, simple procedure is carried out to differentiate between a normal man and supposed to be a man having some disease. The screening procedure may not be 100% confirmatory. It is the initial phase, and this is mostly employed in pre-employment.
Hmm.
When the person is being employed in industry or in
Hmm.
government service, he
Hmm.
or she must go thorough clinical examination or screening,
Yes.
so that at least you know that he is physically fit.
Hmm.
But then there are now many doubts about the utility of screening.
Okay.
People feel that what is the output this screening is giving. So there are again pros and cons about this screening. But one thing is certain, that if
Hmm.
you have a good procedure for screen out, and
Hmm.
if you carry out two-step screening,
Hmm.
like let us say for diabetes, only test
Hmm.
on the finger by a strip, that is the primary, and then go to actually calculation of by electrophoresis method or other methods. Two stage is really important.
Okay. So there is one more query. Asymptomatic behavior is very complex, as you have indicated in the iceberg analogy. How does an epidemiologist identify this, and where does this data come from?
Yeah, this is very pertaining to our present pandemic.
Mm.
In present pandemic also, it is almost certain that there will be at least minimum double to triple cases who are asymptomatic or very mild. So all this lockdown, etc., lockdown, physical distancing, masking, etc., the main role of lockdown is that if the person is infected and he is kept in a house for 5 6 days, 10 days, he only infects the family members,
Mm.
because nobody is going outside. So
Mm.
he infects family member. The family members may have a symptomatic disease or asymptomatic disease, but they are all isolated or they are detained in the family. So that is was the initial concept of having a lockdown, that we can
Mm.
extinguish the disease at the initial phase.
Right in the beginning.
So in asymptomatic phase, at least we know that one third, maybe one third we are detecting. So take a history, clear history, those who are coming in contact with those persons,
Mm.
and quarantine them.
Mm.
They may be asymptomatic, they may be having a mild disease. So you are not allowing even the contacts to spread.
Mm.
So this is the role of quarantine. A symptomatic person, but
Mm.
likely to have harboring the infection, is detained for longest incubation period or longest period of communicability. So
Yes.
in most of these infectious diseases, we try to search out asymptomatic patients by testing. Again, again, I'm taking the same example of COVID.
Mm.
We always wonder, China is not giving true figures or how it is so low in China.
Mm.
I am not arguing that.
Oh.
But what I am clearly giving example, that there was one epidemic in one city of China.
Mm.
In a span of 15 days, they have examined each and every person thrice by RT-PCR test.
Mm.
You may be asymptomatic, you may be anything. Every person was
Mm.
tested thrice. So,
Oh.
uh,
Mm.
so that they could really control the epidemic.
Yes.
So this is asymptomatic. You have to trace them and restrict their movements. That will have a long results.
Right. Sir, I see two more questions over here. Uh, what is the role of non-medical people in levels of prevention. For example, those who come from laboratory sciences or other backgrounds, how can they contribute in prevention of disease?
Yeah. Basically, in prevention of disease, most important is health promotion. And for health promotion, there is no need to have a detailed medical knowledge, even a preliminary knowledge. But what is more important is your convincing power,
Mm,
how you educate them. We
mm,
always give in health education example what is called as Nita, my dear friend Nita. Nita means first thing is that you don't have any knowledge, you feel need. Okay, what is this? What is that? N stands for need.
mm.
Then he or she evaluates it by reading pros, cons, etc.
Right.
Then takes a trial. Here,
Mhm,
is it worth? And if he is happy with the trial, he adopts it.
mm,
So the role of non-medicals is convincing the best convincer. Who is best convincer? If somebody comes and asks me, oh, sir, you use this pest, I will not use this pest. But if Aarti says, sir, this is a good pest, I will certainly use it.
mm,
So we have to convince people who are close, near and dear to us.
mm,
It doesn't require even, it requires your convincing capacity. And all
mm,
these people, it's like a flame. So
mm,
more the people health educate, more will be the effect.
mm. Okay. There is one more question, and that they say, how do we classify diseases like kidney stone or ovarian cyst in your definition of disease, illness, or sickness?
Yeah. Uh, these are basically, as I said, chronic degenerative diseases. Ovarian cyst, it is
Mm,
not malignant, but then probably there is some tumor. And this tumor is due to result of interactions of many actions. For kidney stone, it is almost known that the minerals in the water and the food you take, they are responsible for the kidney stones. And one more is your beer drinkers. Those who extensively drink beer, they are also known or vulnerable for
kidney.
bladder stones
Mm,
or bladder cancer even. So this is the environmental factors, they result into these diseases.
mm. Okay. Um, okay. So students have request if you could share your slides or if any other material for reading
I
purpose.
will share both these PPT to you, madam.
Okay,
You
fine,
can
sir.
share them. Yeah.
Yeah, definitely. We will arrange to share. Okay, if there are no more questions, then there is one, I can see one more question, sir. I'll just read it out. Uh, Most of the diseases are related to viruses. How can we stop the emergence of new virus? Is there any role of climate change?
See, this is I think this is a process of evolution. We call it as the onion scale phenomena. You remove the outer shell, the next cell becomes very prominent. You remove that cell, the third becomes very prominent. It is similarly. We removed plague, we removed smallpox. Now the other things are become very prominent. If you remove and control this, maybe in future something else will be more prominent. It's a
Yes,
process of evolution.
it's unending.
It's an unending process.
Right. Okay, sir. Even the question answer is going to be unending, but we'll have to put full stop to this. Thank you very much, sir. You have given us basic fundamental knowledge of epidemiology, and today's lecture was very informative. The core of epidemiology, if students or participants know these phenomena and these terms, uh, they are very easy to understand, but they must be able to apply those terms
Yes,
or those
that is more
definition
important.
concept, yes, in their day-to-day work. Thank you so much, sir, and we look forward to have more such interaction maybe in next session, in next course, I mean.
Okay,
So
okay.
okay.
Sure.
Okay, sir, thank you very
Bye.
much, sir. Bye, thank you.